Hello, everyone out there. Welcome to our April 24th edition of our briefing. I apologize for being a little bit late today. We actually have a pretty big meeting on Tuesday, and we were doing some recordings for our legislature and giving them the information on what is to be a pretty big agenda. We're doing March and April's meetings together, so I apologize for being a little bit late, but we do have, we're here today to give you our latest update. We've gotten through another week, and there's a bunch of stuff that we'd like to talk to you about. First and foremost, for the public, I'd like to thank our emergency management office staff, especially Rick and Jeff. We will be partnering with Homeland Security and local businesses to distribute masks to the public. Tomorrow is Montgomery County Mask Distribution Day, and it starts at 9 o'clock. And it will go until supplies run out. So if you have any questions, contact the Montgomery County Emergency Management Office. And that number is 853-4011. We good? Oh, you hear it better now? Okay, sorry about that. So Montgomery County, New York Emergency Management Day is tomorrow. We're partnering with Homeland Security, just reiterating, just in case anybody couldn't hear me. We've been pretty busy today. Please bear with us. Tomorrow is our Montgomery County Mask Distribution Day from 9 a.m. till supplies run out. I know Jeff has helped with this and his team, in addition to running around food and supplies to everybody and everything else you do. There's one package of 5 masks per family. There's a limited supply. Call emergency management 853-4011. If you have any questions or concerns, and you'll see, and this is going to be posted up on online, and there are a number of locations in both Fulton and Montgomery counties where you can pick up these masks, and everything from Stewart's to Hannaford to Price Chopper. So check out this information. It'll be online. I'd like to thank Rick and Jeff for working to get this done, and it's going to be a great thing to help distribute masks to everyone. I think I've said it a few times. This is going to be the year of the mask. I have my superhero mask on today. I'm going to try to keep changing it up for you guys. Get to our latest update. We now are at 47 confirmed positive cases. 33 patients have made a full recovery. So that's the good news. 13 home-based monitoring and quarantine. 0 under medical care, more good news there. And there's 37 public health quarantine individuals being monitored. So, I'm going to be putting this map up there. I've been getting some questions on, we put out the map of how many tests per in each zip code and how many positive cases in each zip code. That's not going to be done on a weekly basis. We're going to try to get it done for next week. But, we're obviously digging into the information pretty deeply, because that's going to be a big part of the reopening, which we're going to talk about today. But you probably can't see it here, but we're going to put out a little bit of a bar graph. But you'll see in that, cases per week of new cases. We had 3, 2, 8, and then we had a jump up of 20. Now it's back down 6 and 8. So, we had 1 week where we saw a big spike. Obviously you can't go too far with this, because, they're not huge numbers. But, it does appear that we haven't had a bad week now in 2 weeks. So that's a good thing. The last couple of weeks have been a little bit quieter, with 6 and 8 new positive cases as compared to 20 during that 1 week. So I take some encouragement on that. Jeff has some interesting numbers here. I just want to speak a little bit to the fact that, certainly the situation is wearing on people. Sarah's not here today, and we'll be back, I believe, next week for our briefing. But she did 2.5 hours of calls on the radio today, and she is a soldier and a trooper here. That's tough. But she was a little frustrated today because there was a lot of calls that were more political in nature, and there was a little more anger. And I'd like to just acknowledge that that is what we're seeing, and people are eager to get things back to normal, and as we are, and that process is starting to happen. I'm going to talk to him about it a little bit more. But Jeff, I know you had some numbers. Will you share a little bit about what you're seeing in the county? Because I think what Sarah saw on the radio and what we're seeing in the community, there's a lot of people that are having a really tough time, and tempers seem to be starting to flare a little bit.
Yeah, we talked about it last week where on our sign out front we put be patient, be caring. So we're just trying to reiterate to people, we hope that we're approaching, right? We're leveling off, approaching the end of this, or at least headed in that direction. So please, just try to respect each other. Some of the hot topic calls, mental health calls, fights, domestic violence calls, disorderly persons. We ran the numbers from March 1st till April 24th, and mental health calls have almost doubled. We had 13 in 2019, we got 24 for that time period this year. Fight calls, we had 17 in 2019, we're at 29 for 2020. Domestic violence calls, which is very disturbing to us, was 67 in 2019. We're over 102 for 2020. And disorderly persons, 25 in 2019 to 55. So as you can see, those numbers, some have doubled, some have gone up 30%, 35%. But an increase in those call volumes, we assume, is directly related to everyone being at home more and being cooped up and not having the ability to go to work or go out and do things that they would normally do. And, occasionally you throw in some alcohol involved in that. And so we're just asking people to remember that these are difficult times. Everybody's going through them. We understand that. When we go to these types of calls, we're trying to be very patient with people and trying to educate them and get them the help that they need if that's the type of call that's requested. And we're in this together.
Yeah. Jeff, it's troubling. You're seeing some of these numbers double. That is very real. I think there's a grind that's happening to people, and it's something that we got to keep our eye on. And I encourage everyone out there. We have our Take 5 initiative. Call, check on people, and we all, again, I've said it. We need to be better human beings, and let's try to be a little bit patient. It's difficult times, but that leads into the next topic, which is reopening, and we're at the point now where those conversations are happening. I've been talking to county executives in Mohawk Valley, even Central New York, and I was actually just on the call as I came over here with the office of Ryan McMahon in Onondaga County, talking. He's taking a leadership role along with Tony Picente and trying to put forward a plan for reopening with to the governor, because this is the situation right now, and Jeff, you know this very well. The governor's calling the shots, and what the governor does supersedes what we can do here at the county. So I was just reading an email before I came about a gentleman saying I don't approve with the way you're handling this, and we should be open and this and that. I can't open if the governor doesn't say we can be open. Let me make that pretty clear. But what we can do is work regionally with folks in other counties and try to work together as one to present a plan on how we best feel we can reopen. Because we know our communities better. We're on the ground day to day, and we think we can put a better plan together, and at least something that can provide value to the governor's office. So that's considered during those decisions, and we're doing that right now. Obviously, we don't have the kind of cases you're seeing even in Albany or downstate, but it's still here. It's still going to be a part of, our conversations and our lives for the foreseeable future. It's just how we handle it, how we respond to it. We can't change the coronavirus, but we can change how we handle ourselves, whether it's, some of the issues you described or how we reopen. We really have to focus on what we can control, and that's putting a good plan forward. And that plan is going to be based on, all the health data and what the best practices are as part of social distancing. But I would remind people, this is a time to cherish the fact that you live in the Mohawk Valley, because we are going to be able to do things that other areas that have a much higher density of people aren't going to be able to do. We're going to be able to, it's been fantastic for me to see the amount of people that have been utilizing the bike trail. And obviously keeping distance, but just getting out for that walk, staying away. We put a lot of money into that trail to make it nice, and it's glad. But that's the type of stuff that, people are going to have to take advantage of, as we go throughout this year and we hit that reopening process. I mean, do you have any thoughts, Jeff? I don't want to put you on the spot, but that is the discussion we're having here. How are we going to handle the county? How are we going to handle even things like the DMV and lines, and we're working on these plans. I mean, what are you thinking about your staff and your team?
I was just going to say some great comments on your behalf, because if you look at the numbers and you look at our surrounding counties, even Saratoga County, Schenectady County, and as you move farther east, Albany and Rensselaer County, it's a huge drop off in numbers with positive cases, right, and deaths and people receiving medical treatment. So I'd like to say that, one, we're lucky, but two, I would like to attribute it to the work that Sarah and her team have done. And,
Absolutely.
the people in this county that have taken the time to actually follow the rules and do the right thing, I think has helped us.
I think so too.
Put us in this position to talk about reopening.
I think so too, and that's that. You hear on the news, everybody's talking about how are you going to mobilize to do the tracing and tracking and all that, the antibody testing and all that stuff. That's the tracking and the monitoring and then isolating people and everything that Sarah's been doing. That's been the name of the game thus far. So that one case doesn't turn into 20 cases, and as you see here, clearly, during the 1 week when we had 20 cases and we haven't had more than 10 in another week, clearly that was 1 week where, the spread took hold a little bit. But I would say, yeah, that's a big part of what we're doing. But I would encourage everyone that, okay, yes, things are not going to be normal, but the reopening process is going to happen. We're preparing for that right now. And over the next few weeks, as we come and do these briefings on Fridays, that's going to be a big topic of our discussion. And we want to do it, just like a lot of the messaging you're hearing from others. You want to do it in a smart way, in a safe way that's based off the healthcare information, and we'll take it from there. And I'll give you an idea. Now, the thing that's scary about this, and I can say this just because I'm the county executive and I'm not necessarily a health official, and I can give my opinion. But you saw the study come out talking about the antibody testing, and there was about a 3. They thought there was about a 3% rate of infection in upstate New York. Well, if you take that 3%, over 50,000 people, you're talking about potentially 1,800 people that may have had it in the county. Now, there's a lot of ifs in there. That's just a hypothetical, thing that I want to throw out there just to get us thinking. We have 47 confirmed cases. Obviously, with everything we've heard, there's more out there, people that self-resolved and things of that nature. My hope is that when the data comes in and the more information comes in, hopefully we see that fatality rate drop and we can get back to normal quicker than we would hope, and then really focus on those that are vulnerable. But that's, again, just my opinion. I hope that, as we go forward, that comes to be true, but that's just my take on things personally.
And I think on our behalf, sir, is that as we do approach this time, all we ask is that people pay attention to the rules and people try to follow the reopening rules so that we don't go on the other side of that curve and start to spike back up, right?
Yeah.
We've done a great job up to this point. I know it's extremely difficult and it's frustrating and some people don't think it's proper, but the numbers show that it's working. So as we move forward, let's continue to do the right thing and we'll get out of this quicker.
Well, and I would say to the people that are frustrated, and I certainly in the last few days have been getting more messages about it, certainly feeling a lot of frustration about, the economic consequences. Everybody's thinking about how we can reopen safely, and you're always going to err on the side of safety. Now, as the data starts trickling in, like the antibody study that I just referenced, I mean, that's just the first little piece of what's going to happen with the antibodies and testing. And, we were not included in that first phase as a county. But, as more information comes out, we're going to get more clarity, and that'll help us make decisions, as we move forward. So, our cases are relatively stable right now. We have the mask drop off tomorrow for people that are interested. And then we're going to go through and do some questions. I got one question here. Does the governor have any direct communication with elected county executives or appointed administrative officials throughout the state? Now, I would tell you this, that the communication is going on at all levels. We're talking with the governor's office. I have a rep that is my go-to person that I call, text frequently to get quick answers, helping clarify things. So that communication is there. Our communication with our state representatives is there. As well as in the county, we're setting up a conference call for town supervisors next week. We've been fielding calls from anybody and everybody. It's been nonstop. I'd emphasize that communication is there. It's not always, public or press releases going out, but there's a lot of that communication that's going on a day-to-day basis. Sheriff, just another one for you. I know you'd hate to have to go over this again, but what's been your approach to folks that are not wearing a mask or potentially hosting large gatherings?
I never mind answering the question, even repeat it because it's good for all of us. So we have been receiving complaints, both through emails and phone calls to our dispatch center. What we do is we send a car out, we interview them, we try to educate people. It is not our intentions nor our desire to ticket anyone or make any type of arrest in these situations. We educate as much as we possibly can. We ask and beg them to cooperate and understand why it's important to follow these rules. And we call it a day at that. If we have to continually go back, or if push really comes to shove and we're given a really bad, difficult time by someone, we certainly will take the action necessary and make an arrest if need be. But that is not our intentions or our goals. It's all about education.
And we haven't done that yet,
No.
have we? Okay.
Not one person has been charged.
No, and you know what? And I think that speaks volumes to your team. It requires a lot of patience, like you said, especially when alcohol is involved. I know we've had a few conversations about a couple stories already. I got another question in here. There was a study that was put out there, and it said the question was the county legislator from District 9 recently posted the data from a Cornell EDU study that we're the most vulnerable county in the state for COVID-19 based on population health data. Of the 62 counties, it shows Montgomery County is number one in the state in terms of vulnerability and poor health outcomes. We have a high percentage of our population with diabetes, heart disease, obesity, smoking, asthma, high blood pressure. So this is what I would say to that. And we've got a few calls about this, and this has been a couple of it's generated a lot of calls. I'll say the first thing I'll say first and foremost is I'm not surprised to read something like this, because we have said that we are one of the oldest counties in the state, and with that does come diabetes, heart disease, obesity, asthma, high blood pressure, things of that nature. Are we happy about that? Absolutely not. Are there programs in place that are still ongoing to try to address these things by the county and the state and the federal government? You see the smoking commercials on television, you see the billboards, you see the various programs that public health does. We obviously take that seriously and are trying to do everything we can, but I do think our demographics play a big role in why we are where we are on that list. And, it's certainly not the best news, but, yes, I mean, we're always working to try to promote, public health. We do a lot of outreach. We send out information. I mean, even amongst our employees, we've been trying to we have a wellness committee and trying to, do what we can there and to promote healthy living. But, I would just emphasize to people, we do acknowledge it. We understand it. Quite frankly, I didn't need that Cornell study to tell us we're at risk. On the first day we were here, I said to everyone, the reason I'm so concerned is because of our population, and it's not just age, it's because of these things as well. So, you do the best you can with the resources you have, and, that's that. And obviously, if anyone has any more specific questions, Sarah reiterated to me, we had a couple people that had some questions. She'd be happy to talk one-on-one with folks that, want. But that's, again, I think it's why we try to promote a lot of the recreational activities and things of that nature. Let me just review my list here. Similar questions about testing. Yes, we don't have the amount of testing that we want still. We have to use a set of criteria to test people with our county tests, and there are others that are testing. As we go forward, I think, that's where you're going to start to see big changes. I think you're going to see a lot more testing. You're going to see a lot more the antibody testing. And also you're going to see a lot more of the things as you reopen, such as taking your temperature. We went and bought a number of thermometers a few weeks ago that have come in. Did they come in, Jeff?
Yes.
Yep. Okay. And so, as we look to reopen and what our protocols are going to be for running an organization with 500 employees or approximately, those are going to be the type of things you have to do. You have to wear your masks and unfortunately, that's the world we're going to be living in for the foreseeable future. And lastly on my list, and we'll get to some questions from Morgan. How are we doing on questions? We got a few today? Okay. How would you suggest where people should get their information? Well, I've been reiterating that from the beginning. start with your trusted sources, your municipal, county website, Facebook, Instagram, Twitter. We're doing all that. A lot of that information is there. We have a dedicated page on our website. The sheriff's page has been putting out a lot of information. And just always try to find credible sources. Be very weary of articles and that are from organizations that you've never heard of. Try to stick to reliable sources and do the best you can. So Morgan, we got some questions.
Another question is regarding schools reopening.
Oh yes. The question that is probably number one everywhere. So again, I'll give you my personal opinion. I find it very difficult to see that schools are going to reopen again this year. As far as summer classes, I don't know. I believe Schenectady Community College is doing all online summer classes and announced that already. So I have not heard anything official as far as the rest of the school year. And again, that's a decision for your superintendents. And so please, call your teachers, call your superintendents, depending on what district you're in. But my personal opinion is I think they're going to have a very difficult time to open this year. I mean, you really only have until June. My wife's a teacher, and God bless all the teachers out there who are trying to adjust and do online learning and use all the different platforms. But I just find it hard to believe that they're going to reopen again this year. But that's just one man's opinion, and you gotta look to your superintendent and school board members.
Is there any direction yet from municipalities about holding Memorial Day parades?
No. I think that's going to probably be curtailed in some regard. But that's still a little ways away. But no direction. I think we're just, taking it 1 week at a time here. I think my general answer would be to that is, in anything over the course of this year, I don't think we're going to see any large gatherings, going into the summer. As far as having 100 people together in a tight confined space, I think that's going to be very difficult because that's where you run the risk of having a big outbreak. Will there still be things that you're allowed to do? Yes, but it's going to feel different. Morgan, how many times have I said to you, every day the abnormal becomes normal? That's what's happening. So I'd be surprised if we had a normal Memorial Day parade, but this is a creative community, and we'll see what kind of ideas we come up with.
Jeff, I would say maybe this is for you. Someone mentioned that they still feel like a lot of people inside stores are still not wearing masks. Are you still referring people to the New York Pause number?
Well, they are. They can call us direct, but that certainly is the place to go. And we actually have that number here. It's 1-833-789-0470. 833-789-0470. But I will say this, Morgan, a lot of stores have reached out to us recently and have told us what they're doing. And many of them, although maybe they should have done it a little while ago, are doing a much better job now, limiting how many people go in, encouraging people to wear masks or face coverings. But let's not forget the face covering requirement is only if you cannot practice social distancing. So sometimes people get upset when they see somebody without a face covering. If they're alone and not within that 6-foot radius, they're okay. They're meeting the executive order requirements.
That's a point that I think people have missed.
Yeah.
So it's, for example, you've seen a lot of jokes on social media about driving in your car with the mask on and it's only you. You're in the car, you don't got to have it. And you're not within 6 people. If I'm out mowing my lawn and there's nobody around, you're not required to wear one. But again, I would just say use common sense. Morgan, before you get to more questions, I just wanted to also highlight a quick positive story. We gave our Small Business of the Month award this month to Saratoga Horseworks, which is a local manufacturer on Edson Street in Amsterdam, and they turned around their operation to make face shields and gowns, and we're buying some from them. They're supporting not only businesses and hospitals and things of that nature, but they've actually created individual packages for a healthcare worker to come in and buy. So we gave them our Small Business of the Month award, and just wanted to recognize and thank Mike and his team at Saratoga Horseworks. What a story. He's still got 60% of his employees working there, and has done a great job, just stepping up to the plate and trying to help out the community. So
They actually donated a case of face shields to
awesome.
the undersheriff who brought them for our staff here at the office.
That's fantastic.
Very much appreciated.
It's a great local business, been around for over 30 years, And when times got tough, boy, they jumped right into action, and we couldn't be more proud. And I thought it was a tremendous story to tell, and just wanted to say an additional thank you to Mike and his team. Morgan?
Jeff, I believe you already answered this, but maybe if you could just recap a little bit. Someone asked, are you arresting or just giving notice to those who are still holding gatherings?
We are educating people. We have not arrested anyone. It is not our intentions to, nor do we want to. But if we continue to go to the same place, or if we go there to try to provide education and are given a hard time, and it gets to a point that an arrest has to be made, we are not afraid to do so. We just want to reiterate to people, though, that we're in this together.
Mm-hmm.
The more we all follow the rules, hopefully we'll get out of this together in a sooner time period. So we have not arrested anyone yet.
Well, Jeff, and think about how many times we're going to be saying that this year, because right now you have the guideline of the masks and the gatherings and things of that nature. But as we shift to reopening, everything's going to continue to change, and there's going to be new guidelines, and there's going to be new direction handed down from the state, and some of it might come from the county. So that's why we feel this briefing, as well as our social media, is going to be so important for people to follow. So you can, when the governor comes out with something, say on a Wednesday, and we can get it out there and maybe help explain it locally and give you the local flavor that we're trying to do here. That's the purpose of this, and that's going to be ongoing. There's a lot of things we don't know, but one of the things we do know is that we're going to be giving guidance on state executive orders and executive action for the foreseeable future, and people just need to do the best they can to comply with that and seek out what the facts are.
I don't think there's any more questions.
No more questions? Jeff, do you have any parting words for the audience?
I think one last thing that's important to always reiterate is the scams.
Yes.
You know, we have to mention that every time because people get complacent and they forget. Do not provide any Social Security, date of birth, bank account information over the phone to anyone that you do not know or that you have not called specifically.
Yeah.
There's people out there trying to take advantage of everybody with PPE and gift cards and trying to sell things and get you to donate money. And if you haven't reached out to them or you don't know exactly who you're talking to, hang the phone up politely and call it that, or check with your local law enforcement.
That's great advice. I experienced that scam in a personal way, and that's not good. So I'm just going to do a couple little things to recap, and before I do that, just want to say a big shout out to the folks that did the food drop off today in Amsterdam. Jeff and Rick from our emergency management office reached out to get the National Guard there. And they were there, and they were like a well-oiled machine, and then there was volunteers passing out the food as they went through. And I got to tell you, being there versus hearing about it in previous weeks was a very different experience. And I want to just say that those Mayor Cinquati and his team and all the volunteers there, great job. They helped out a lot of people today. And I would also emphasize that that's happening all across the county. Food drives and things of that nature from our churches, our nonprofits, individual to individual. I don't think we're going to need anything that big in the western part of the county. I mean, would you think we're going to need any? Do you think that's going to head that direction?
Well, they've done one already, and I think there's another one scheduled in the Catholic Church parking lot on Reed Street in Fort Plain. Not quite as big as Amsterdam, but we are working on one in the central part of the county that would cover the entire county.
Great.
And details to come.
Great. All right. Well, we're just going to keep doing that. Big reminder, tomorrow is the Montgomery County Mask Distribution Day. They're going to be distributed in both Fulton and Montgomery counties. Check out our social media. Morgan, we're going to get this posted up there. It's already up there. Great. There's a whole host of locations where you can get your masks. One package of 5 masks per family. And I'll reiterate, it starts at 9 a.m. and it's until supplies run out. Right, guys? Okay. So if you got any questions, emergency management office is 853-4011. And then just lastly, where we are at 47 cases, we did have about 8 new ones this week. So that's a better rate of infection than we've had a few weeks ago. So everybody out there, thank you for doing your part, and hang in there. We got a ways to go, but keep tuned in so we can give you the latest guidance of what's going on as we start to look to reopening and planning for that. And until then, everybody be safe and be well. Thank you.
Thank you.